Thank you, and good afternoon. Today, the County of San Diego passes 1,000 positive coronavirus cases. While expected, this moment should serve to reinforce to us all the difficult road ahead, the seriousness of the challenge we face, but most importantly should serve as a call to action, a renewed focus and a commitment to have this moment, the point at which we pass 1,000 cases, not be a reflection on what has happened over the last month, but rather as a motivator for what we must all do in the month to come. We have talked a great deal about the important role that April plays in the efforts as we move forward, where we must fully commit to flattening the curve. While we expect the cases to continue to increase, each and every one of us has a role to play in having this next 30 days be the defining moment for our region and the point at which we will chart our trajectory of if we end up like a jurisdiction like Italy or scenes we're seeing out of New York, or if we make it through under the capacity of our healthcare system. And the actions on each and every single one of us are the ones that are going to determine what the future holds for San Diego. After yesterday's press conference, we received a number of questions about the order, and we are in part asking for the public's continued patience in an ever-changing situation and an ever-evolving challenge of confronting coronavirus. Our guidance, our instructions, our public health orders, they will continue to change as well. We must every day adapt to the latest information. We must adapt to the newest opportunity to protect one another, and so we will continue to provide updated guidance. We also know in a world and an economy as complex, with as much information as flowing, that at times it is really important that we continue to reiterate this advice and guidance to try and provide clarity for the public so that they know what the expectations are on what they do. So I'm going to briefly walk through the three sections of the order that we provided yesterday. The amendments to the order from Dr. Wooten first talked about physical distancing and sanitation protocols for all essential businesses who are open. Essentially what this order does is say if you are an essential business as defined by the governor's executive order and you are open for business, then you must post outside your facility by Tuesday morning your physical distancing and sanitation protocols and policies. If you go to our website at coronavirus-sd.com, you will see a link that says Social Distancing Plan for Businesses. This is a template, it is a guide. You can use this template and guide in filling it out. I have a copy of it here. You can simply fill in the blanks and post yours, or you can create your own. But we are first asking all businesses that remain open. If you are open today, you should only be an essential business. And if you are open, by Tuesday morning, you need to post outside your location and provide a copy to all of your employees of your plan for physical distancing and sanitation protocols. And again, we've provided guidance to that effort. The second part of our order related to face coverings. And first off, we want to be clear that face coverings are distinct and different from medical masks. A medical mask, whether it's a surgical mask, an N95 respirator, a medical mask is something that belongs in a medical facility. And we continue to ask the public, if you have those, please provide those to medical facilities or to the County of San Diego because those are the workers who need that level of protection most. A face covering is something as simple as a bandana. It is something as simple as a gaiter. It is something as simple as taking a sheet, tearing it in parts, and wrapping it around your head. And so a face covering is something that each and every one of us can acquire or make on our own. And for the broader public, we have not issued a legal mandate or requirement that you must wear them when you leave your home. But we are issuing a strong recommendation that you should. It has the potential to protect yourself, but perhaps more importantly, it has the potential to protect others. And so we are asking folks to wear a facial covering, not a surgical or medical grade mask when they go out, anytime that you leave your house. Now, we are having a requirement for the employees of a handful of categories of essential businesses only, that the employees of grocery stores, pharmacies or drugstores, convenience stores, gas stations, and restaurants. The employees of these 5 facilities, those folks shall wear a face covering while they are at work. Again, to reiterate, the businesses that are covered by a requirement that your employees must wear a face covering while at work are grocery stores, pharmacies and drugstores, convenience stores, gas stations, and restaurants. Restaurants were added after our press briefing yesterday, and I actually want to take a moment to thank the Restaurant Association. You're going to hear from Jeff in a minute. The Restaurant Association reached out to us and said, we would like to be included in this order. We want the public to have full confidence that we are doing everything that we can to protect them and protect all of us. And we're grateful for the Restaurant Association and the other business leaders that stepped up and said, we know that it is quick, we know that it is something different, but we want to be a good partner and we want to comply, and we are grateful for that. So again, for the broader public, it is a recommendation, something we strongly recommend and we encourage you to do to cover your face when you leave your home. For these 5 entities of essential businesses, grocery stores, pharmacies, convenience stores, gas stations, and restaurants, starting at midnight tonight, you must have face coverings for your employees. The third part of our order related to parks, recreation centers, and beaches. We have a public health order in place today that says each jurisdiction can decide if they want to have these facilities remain opened or closed. If they can ensure physical distancing, and if they have a sanitation protocol and plan, then individual jurisdictions can choose to keep parks and recreation centers open. However, county-wide, all parking lots of these facilities must be closed. Additionally, all of these entities, parks and recreation centers, either have to have a sign up that says they're closed, or if they remain open, they have to have a sign up with their plan for physical distancing and sanitation, just like all essential businesses who remain open. The aim here is to ensure that those jurisdictions that keep them open have a plan and protocol to comply, and by closing the parking lots, we believe that we can lessen the gathering and we can lessen folks traveling from one entity to another. The reality is you shouldn't be driving to a park or recreation center. If there's one near you and you can walk to it, then that is okay. Our public health order also distinguishes between active recreation and passive recreation. Passive recreation, hiking, walking, biking is allowed in those jurisdictions, centers that remain open. Active recreation is not. Basketball, volleyball, football. Included in active recreation are swimming, surfing, and recreational boating. All of those activities are prohibited county-wide. That goes in effect Monday at midnight. With those 3 orders having been covered, let's get into our charts and updates quickly. The first one you will see here, as I alluded, we had an increase of 146 cases, which brings us to 1,112. Again, expected change, but change that should reinforce and remotivate to all of the public the vital importance that the coming days play. Number of tests, we are now over 15,000 tests that have been conducted in San Diego County, with a daily increase of more than 1,800. Again, the day-to-day numbers do not reflect a great deal. It is the broader trends, and the trends continue to show a positive increase in the number of testing available in San Diego County, a trend that we would like to see continued into the future. The next chart here really represents graphically the difference between the increase in testing and the increase in the number of positives. As we've seen our daily increase in the number of testing go up, we have seen an increase in the number of positives, but there is, of course, some encouragement here that there is a vast difference between the number of tests being conducted and the positive cases being reported, and we hope to see this trend continue. Likewise, on the next chart, you'll see a comparison between the positive tests, the number of hospitalizations, ICU hospitalizations, and the unfortunate loss of life. Again, you can see that although all of these trend up, we are continuing to be able to maintain the healthcare capacity of our system for the time being. Next slide, you see our outreach efforts increase in 211 calls. 211 is doing a heroic job, and we are working to continue to support them more. Increase in calls to the nursing line, our epi calls. The hygiene kits, I just want to take a second and talk about this because we're now over 2,000 hygiene kits that have been distributed. Here you see individuals who are assembling these hygiene kits. They have water, hand sanitizer, information about coronavirus, soap, a variety of things. These are being distributed by the San Diego Police Department officers, PERT clinicians, health and human service specialists with the Central and South region, and they are out every single day encountering the unsheltered, making sure that they know available services that are there, screening for individuals with symptoms, and encouraging positive hygiene efforts as we try our outreach efforts with all of San Diegans, regardless of their housing situation. Next chart is the number of motel rooms. Our public health motel rooms, we begin to see an increase in the occupancy on those, along with the rooms that we have transferred to the Regional Task Force on Homeless for vulnerable seniors. Next is personal protective equipment. Again, this is a very important statistic and chart. We are now approaching 1.4 million items of personal protective equipment that have been distributed to date. These are individual items that have been provided to our healthcare partners. You see an increase in N95 respirators, surgical masks, face shields, goggles, gowns. We continue to aggressively acquire as many supplies as we can and to get out as best we can to those what we believe they need. Final slide on charts is ventilators. We've talked about the vital importance that ventilators play in a response to the coronavirus. I am pleased to report that all 23 of our San Diego-based hospitals are reporting their numbers, and we appreciate their help and cooperation and coordination. There's an increase in the total available today of about 100. Again, day to day, you can't read a lot into that other than we have full participation, and we presently have ventilator stocks. We have an increase in our ready reserve that are ready to deploy at a moment's notice, and we continue to await the shipments of those we've ordered, along with further guidance from the state of California on what we can expect to receive from them. The very last point that I want to make is an important one, and that I want to give a particular shout out and appreciation to all of the county workers who are in our Emergency Operations Center. These are the individuals who you don't see on a daily basis, but those of us here see. We see their commitment, we see their professionalism, we see them coming in and day out. We appreciate the sacrifice that they give. We appreciate their families' patience. And I will tell you, as a combat veteran of the United States Marine Corps who did multiple deployments, I have never worked with a better team than those county individuals who show up at our Emergency Operations Center every day, fully committed to the task of protecting the public. And I couldn't be more pleased to be a part of this team. And I'm incredibly grateful for each and every one of them and the aggressive nature that they bring in doing everything we can to serve San Diego.